In the heart of North Minneapolis, NorthPoint Health and Wellness Center has been providing health care and social services to our residents for more than 50 years. Originally known as Pilot City, NorthPoint is one of the original 13 neighborhood service programs started across the country as part of the Johnson administration's war on poverty. During the racial turmoil in the 1960s, these multi-service centers were established to provide access to health care and human service programs for underserved communities. April Estes worked as a nurse at Pilot City.
Pilot City was a place for the community, North Minneapolis community, because they knew they had somewhere to go and they wouldn't be turned away. We would see everyone regardless.
When I first started, we had an IBM typewriter that had a small amount of memory.
Pharmacy technicians Sandra Gaffney and Lee Smith have been working here for decades and became familiar faces to patients.
Oh, I remember you when I was little. Yes.
I think I've seen 4 generations.
We are a community institution, something that you're familiar with, and trust is extremely important.
NorthPoint gained generations of trust by treating everybody with respect and care they deserve, regardless of race, gender, or socioeconomic status.
I see the way they provide us here, the way they interact with their patient, and being a nursing student, that is become an eye-opening for me. That we have to have connection and empathy with our patient first, before we can give them a care. The spirit inside NorthPoint, they welcome you like a family.
That spirit most likely comes from employees' love for working at NorthPoint.
My heart is here, continue to here till as long as I can.
I always tell people that this was my dream job, and it doesn't even feel like a job to me. It feels like a calling. I just feel like this is what I was supposed to do and this is where I was supposed to be.
Today, 400 employees serve more than 25,000 patients for medical, dental, and mental health, as well as 15,000 residents receiving social services annually. Here, anyone can receive services without worrying about their finance. Patients can plan multiple visits on the same day, all in one location, and readily available interpreters help those who are not fluent in English. 25 in-house interpreters help patients with Spanish, Laotian, and Hmong. And this service extends to more than 70 on-demand languages.
It's important that they feel comfortable coming from wherever they are. If they're able to communicate their issues and get a response back in that native language that they have, then they feel like that they can open up.
Community health worker Mai Veng Zhang knows firsthand how important interpreters are for these patients. Her parents have been coming to see doctors here at NorthPoint for many years.
I want to give them space to kind of tell, go through somebody else instead of me. And sometimes my parents might open up a little bit more about their illness.
This approach of listening and providing what the community needs is one of NorthPoint's greatest strengths.
People have varying perspectives and it's needed.
And those perspectives extend throughout the organization, up to the community board that oversees operations and makes decisions on policies and procedures to ensure the clinic runs effectively. The majority of the board members are patients or clients of NorthPoint.
It means that we're not just looking at what's required legally to run the organization. We're also looking at what makes this the most welcoming, caring organization that we want to be a patient of, a partner in the community, as well as on the board. It's not about making money or the bottom line. It really is about how do we come together for our health.
Now people are coming together around the NorthPoint campus expansion, making it possible to continue to keep up with the growing needs of this vibrant community.
I think it's a blessed clinic, and it should be here. This is where it's supposed to be. And I believe that it will always be here.
After more than 50 years of making a difference, NorthPoint will continue its legacy and vision, moving forward in charting a future in partnership with patients, clients, community partners, and the North Minneapolis community.
Our future still embraces the past, and that we still are that place in the community where people can come for all of those services. And we are focused on achieving positive health outcomes for the community.